Perfect. So thank you very much indeed for having me to speak today. And thanks also, Anna, for a wonderful presentation on jellyfish. We're going to segue now into snakes. And as already introduced, my name's Beth and I'm a medical doctor based in Oxford. And I'm going to talk to you a little bit today about the 7 months I spent in Myanmar working on a snakebite project. At the moment, obviously back in Oxford, sadly no time to travel, and currently still managing to do some clinical work, but also the snakebite work, which is brilliant. So snakebite is a global health problem of significant standing, responsible for up to 138,000 deaths every year, and leaves around 400,000 with permanent disability. And it really affects the rural poor in the tropics and subtropics, particularly Southeast Asia and notably Myanmar, which is where I spent my time. And on the right here, you've got the Russell's viper, which is responsible for about 85% of the venomous snake bites. But sadly, in Myanmar, they've got a whole host of venomous snakes, the cobras, king cobras, kraits, green pit vipers, and sea snakes. And unfortunately, the traditional treatment is still very commonplace. So tourniquet is probably the most common. And you can see on the top left, these are all pictures I've taken from the hospital. So top left, you can see these tiny dots over this gentleman's shins where he's had tattooing done as a traditional treatment. In the middle, you can see these sort of faint dots along the inside of the foot here, which is actually tattooing done prophylactically to prevent against snake bite. And on the right, there's a cut, this idea that you can sort of drain the venom out, which unfortunately is not the case. And indeed, I've seen notes of a patient who performed this sort of cutting procedure and actually went to intensive care, not for the snake bite, but because they ended up getting tetanus. So sadly, these are still very common. They delay access to getting proper treatments and they can be harmful in their own rights. So I was hoping really that my time in Myanmar working on snakebite would be a small contribution towards the very ambitious target that the WHO has set for us, which is halving death and disability from snakebite by 2030. So I would strongly recommend Myanmar as a place to visit. It's a wonderful country. It's a rural agricultural country, called the Rice Bowl of Asia because of all the many crops it produces. Rice is the main crop. And I was based in Yangon down at the south here, and that was one of 6 high incidence regions for snakebite. And this impressive red brick building at the top is the Tertiary Referral Centre, the quite large hospital where I spent all my time. And I worked on 2 projects really. I'll talk a little bit about the first one and then talk more about the second one, which I think is a bit more interesting. So first of all, we wanted to start, that's I and the local team I was working with, by collecting some baseline data about what is going on with snakebite in this Yangon area. And there was a similar study that was prospective in Mandalay, which is sort of up here in the middle of the country. So we wanted to get a similar sort of data set for Yangon. So we decided to go through all the patient records, all of the patients that were admitted to the hospital within a 12-month period, and collected information about the people who were being bitten and what were the circumstances of the bite. And also we looked at what traditional treatment was used, if any proper first aid treatment was used. In hospital, we looked at the time to antivenom and how much antivenom they received, and then also some of the clinical outcomes as well. And that information helped guide the second part of the project. So the second part was making some new posters, some new snakebite education resources. Because when I first arrived in Myanmar, I spent a lot of time asking my colleagues and everyone I met, trying to understand what the problem is for snakebite in Myanmar. And everyone told me the biggest difference to improving outcomes would be prevention, focusing on this. And of course, they were absolutely right. But I thought at the beginning, how can I focus on prevention when I'm working in this, large tertiary referral centre in this hospital? But I did find in the hospital that they'd had these snakebite posters, but they were made back in 1994, and they were quite outdated, and the colours were, quite faded. And some of the equipment that was used was not things that were being used in current day. So I started off by asking my colleagues on the ward, the doctors and the nurses, what do you like about them? What is good, and what could be a bit better? And we created quite a long list of things that we could improve. But an interesting thing that otherwise would have passed me by was that they really loved the cartoon character that was being used. It was called Tupi, very famous and well known. So I thought, well, brilliant. You know, how can I use this character to make the new posters? Because that would be great. It so transpired, however, that the man who'd made these original posters had actually passed away. But later on, I found out that his widow was actually still making the cartoons. So I thought, great, but you know, how on earth am I going to find this lady? So I put out a post on a popular Facebook site for both expats and local Burmese, and I said, this is who I am, this is what I'm trying to do, and can anyone help me? Fortunately for me, I was given an address. I didn't know what the address corresponded to, but I decided I would go and have a look. And so I drove about 45 minutes across the city with someone who could speak Burmese. And fortunately for me, I was able to find this lady, and she very kindly agreed to giving us the copyright to use this cartoon character. So I'm just going to show you some of the cartoons coming up shortly after this one. This is one of two posters that formed the sort of pack of posters that we made. One of two posters about the venomous snakes of Myanmar. So this, you know, is really more aimed at clinicians. It's got some good high quality pictures and some information about the clinical syndrome of envenoming, so that it would be helpful for people if a snake is brought in to help identify the snake, or perhaps if it's not clear what is bitten, that patient then actually using that information about the syndrome of envenoming will be helpful. But getting on to the good stuff then. So these are the cartoons, and this is the character Tupi here, who you can see who's showing his friend how to use the correct first aid treatment, the pressure pad immobilization technique. And this is actually also based on local research done in Myanmar by Professor Tunpe, and really obviously emphasising that you need to get to hospital as soon as possible. So then we've got this is a new poster, which wasn't in existence before, but we felt that actually, as I've already mentioned, the traditional treatments are harmful, and actually this deserved a bit more time, a bit more emphasis, making that clear. So you've got things like the tourniquet and the tattooing that we've spoken about already. And then the last one is prevention. So you can see here, we're talking about making noise, using a light, using a bed net, making sure it's well tucked in, and clearing up rubbish. So what happened then when we had those posters? Well, so we were fortunate enough to get them published in the Myanmar Times, and the national newspaper was brilliant. They were put up around the hospital and given to local NGOs to use as well. And then the picture you see on the right was brilliant. It was the Burmese Red Cross who very kindly delivered some teaching and training on our behalf to a local farming school. And this farming school takes young people from remote and rural areas that would be the prime areas at risk of snakebite, and they teach about different farming techniques. And this snakebite education has now been incorporated into the curriculum, and the hope is that they will then take that information and that message back to their communities where they go back to. But ultimately, more importantly, the education resources were handed over to the Ministry of Health and Sport, and will be sadly delayed with COVID, but will be distributed around the country, which is fantastic. And also they're being used in India as well, in Tamil Nadu, by another NGO. So I thought I'd focus on that rather than the research findings, because there's so much research, there's so much data that we came up with. And so that's a bit of a whistle-stop tour through the 7 months I spent in Myanmar, and very happy to answer any questions anyone might have on it.
Yes, thank you for your talk there. And I'm now going to hand you over to Rohit for questions.
Hi, have cartoons like this been used in any other countries to better educate people about snakebite?
Yes, so Health Action International have got some snakebite posters that they use as well, which are more targeted at Africa. I think that's just pictures rather than using a local sort of well-known cartoon character per se. But particularly in Myanmar, we knew that cartoons were very popular still, so I felt that would be a good way to give the message rather than using a photograph, for example, and a better way of engaging with people.
Yeah. So Is there any challenge sort of unique to Myanmar that you don't find in any other of the neighbouring countries around Asia?
That's a good question. I think what was different, certainly for Myanmar, is because they were shut as a country for so long due to the sort of the military rule, they sort of skipped the technological era, I suppose, that many other places have transitioned through. So rather than being au fait with computers and Excel and these kind of things, they've sort of skipped that and gone straight to mobile phones. So I think, you know, they commonly use Facebook a lot, but they don't really use the internet. I think less people have email accounts, which I think you need to have an email account in order to get apps and certain things like that. So I think that the technology side is quite different. And when you're looking at engagement with people, technology, obviously nowadays, social media, all these things is a huge part of it. So I think that certainly is different for Myanmar compared to many other countries. Yeah. And
I guess tying on to that is, are you aware of the extent COVID has disrupted snakebite treatment in Myanmar?
So yes, I think so. I attended a webinar actually recently, and it was people presenting from different countries around Asia. And again, there was one of my colleagues in Myanmar speaking about it. And I think Myanmar has been affected probably similarly to many places. I suppose what's good for Myanmar is that they have their own company producing antivenom, whereas other places having problems getting antivenom. At least they're able to produce it locally in country. But I think it's probably not unique to Myanmar that people are not attending healthcare facilities. Obviously, we're seeing that here in the UK as well, aren't we? And so people are not seeing the number of cases of snakebite that they would expect, and so that is obviously concerning.
Yeah. So are you planning to return? And I know it's not going to be anytime soon, but what would be next if you do return? Yeah, that's a good question. I would love to. I really would. I have no current plans to go anywhere, sadly, as I imagine most of us don't. But at the moment, I'm working on a community engagement toolkit, and we'd like to pilot that at some point. And you know, I think we'd probably pilot that in Africa, but I'd certainly love to continue my links with Myanmar because it's a wonderful place and wonderful people there. Yeah, and so what's antivenom availability like in Myanmar? So there are two antivenoms available for the Russell's viper, as I said, which is causes the bulk of envenoming, and also antivenoms for cobras as well. So there are other snakes that they don't have antivenoms for, like the green pit viper, for example. But I think certainly where I was, I was in a tertiary referral centre and the availability was good. Now I imagine that smaller facilities, smaller hospitals, more rurally, I imagine that isn't the case, but I'm not quite sure is the honest answer. Certainly better than it was, because with the Burma pharmaceutical industries developing more antivenom, and they've also switched to, rather than producing a liquid version that has to be kept in a fridge, they've now been able to produce the lyophilized freeze-dried version that doesn't have to be part of a cold chain. So that's another way of increasing availability in more peripheral rural areas. So it's certainly better than it was, but I can't quite say exactly in these more remote and rural areas what it is like at the moment. Okay, yeah. And so the poster mentioned 85% of bites are Deboia siamensis. Does Narcothea make up a big portion of the rest of the bites, or is it quite varied among the different species? Yeah, I think the next biggest category was the cobra envenoming, but it depends on the area as well. And certainly there was one particular place in Yangon, even in the city, there was a place called Bahan, which there seemed to be a lot of green pit viper bites there for some particular reason. Not quite sure. So yes, it certainly was a reasonable amount of cobra bites. Yeah, I wonder whether the data that we have seen, which shows less cobra bites, is potentially that when if it causes respiratory paralysis, that you just don't see these patients making their way to the hospital because they pass away perhaps before. So I think it'd be good to get some better data. Yeah, that's it for questions. So thank you very much.
Brilliant. Thank you very much, Beth.
Thank you very much. Thanks for having me.
We are going to hand over to Dr. Alistair Hubbard, who is going to be presenting on using some toxins